Oh, holy cow. Feeling all fired up, one-hit wonders, and of course, don't pull it out. In honor of the new director's cut coming out, today we are breaking down and reacting to all of these samurai-induced medical scenes and intense injuries from Ghost of Tsushima. Let's dive right in. Oh my gosh! A samurai sword taking one swipe through, what are you cutting through? You got your soft tissue, you got your skin, you have your vertebral column, bone, connective tissue, ligaments, tendons, everything's getting cut through. So could this actually happen? Yes. As long as something is super sharp and then you have enough speed and some weight behind it, you can do a lot of damage. Wow, these are really cool, awesome moves.
Still got the moves.
I always tell everybody, be careful. Falls greater than 3 times your height, 15 feet, would be assessed as a major trauma. If you're able to land on your feet well, tuck and roll, not have an injury, then obviously you're not going to be seeking medical care and a trauma won't be activated. Stab wound, looks like into the chest. The guy drops like a sack of potatoes, dies immediately. Unlikely. You can have fractured rib, punctured right lung, maybe hit the liver on that side. So the liver hides up under the right side of your body, underneath the ribs. That's why it's there. It hides and protects up there. If you have a bad foreign body that's punctured into your body, please don't remove it immediately. Don't like freak out and try to pull it, because bad things are gonna happen. Oh, holy cow. Puncture wound, right side of the neck going into the thoracic cavity. What could happen in that area? Nothing good. You got your jugular vein, you got your carotid artery sitting right there. You have your subclavian vessels, so basically underneath the clavicle. And then that blade goes straight down and it can go right into your lung. Oh. You have a nasty stab wound to the left lower part of your back. What anatomy is over there? Depending on how high it is, you have your spleen that sits right underneath the ribs there. But below that, you got your kidney, or kidney's kind of right next to it, a little bit more midline. Then you have your ureters, which is basically the tube from your kidney down to your bladder. And then intestines. Okay, you got a lot of muscles in that area. So you're thinking, poof, getting released into the abdomen. Ooh. It's a little cold. Oh, nice. Okay, we got flame. What happens in blast injuries? Your eardrums can potentially pop. Your lungs can potentially pop. Shrapnel injuries, wounds relating to the skin from the fire. Then you worry, did it light your clothes on fire? Unlikely. Compressive forces, ringing in the ears, tinnitus, which is like the high-pitched ringing. You can also have your equilibrium distorted to where you're off balance. Whoa, hey, that was pretty lucky. Oh! Stab wound right next to the neck, into the thoracic cavity. Depending on the angle, could hit right into the lung, could hit the heart and the lung, your mediastinal structures. The heart's in there, your esophagus runs through there, your trachea, and the airway. You can rupture into that area, hit the heart, you can bleed out and die. Hit the lung, you may have a chance if you can repair it or get it to not collapse. Oh, stabbing right into the abdomen. You go through the abdominal wall, you go through all those muscles, but you worry about hitting the aorta. If your aorta ruptures in the abdomen, you have minutes before you die. If it's ruptured or cut in the front going forward, it's just gonna pull out and you're gonna bleed out. And once you get 50% or more of your blood volume bleeding out, is not compatible with life. The amount of acrobatic type injuries here, where somebody's flying through the air and then using their blade as the penetrating weapon, force of gravity as you're coming down, you have a lot more force than if you were able just to swing this or do it from a standing position. So it can go a lot deeper and slice in like butter versus hacking in there and doing a little bit harder movements. Oh, blade to maybe the right posterior neck, or is it like the upper back? So you have the scapula in the way, so we didn't see it bounce off the bone. Because if you're doing like that motion, could you break through the pretty thick scapula, maybe, maybe not. But if it's through the soft tissue, yes, you're going through the trapezius muscle, you can go through the upper lung. Oh man, using some nice force. I've seen people fall out of trees from great heights, land on weird surfaces, and cause significant amount of spinal trauma and paralyzation of the individual because the spine just snaps as a fulcrum over whatever you fall on. Please be aware of your surroundings. Don't stand close to ledges and cliffs like this.
Don't go chasing waterfalls.
Whoa! What would happen if somebody gets lit on fire like that? You're gonna get multiple different types of degrees of burns. First, second, third, and fourth degree burns. Fourth degree burns going deep into the muscles and the bone. Most people experience first and second degree burns in their life. First degree is just like the redness. Second degree, it starts to bubble up. Really cool graphics, I like it. Oh. The arrow didn't go that deep and it's stuck in the skin, maybe into the lung tissue on that left side, maybe caused a little bit of bleeding, maybe a little bit of a puncture of the lung, but you're still doing okay. But with every breath, there's an increased risk that air is filling up around that lung, compressing the lung down in the thoracic cavity.
You're late.
You're impatient.
Anytime you are faced with a fight or flight response, everything gets activated in your body. And I actually formulated something called chillax. It's not going to help you in a samurai battle, but it will help you unwind or take the edge off. Check it out if you're interested. I'll link to it below.
Where's the monk?
The beat me to him.
I mean,
him at the temple.
Come on.
you're hitting the right side. The heart is actually more on the left side of that person. Would this immediately kill the individual? No. Cause a lot of pain and could cause some bleeding and maybe puncture the other lung. But again, you're potentially missing the heart unless you have dextrocardia, where your heart goes the opposite direction, or situs inversus, where all of your organs go to the other side. Ooh. Whoa! Got hit with an arrow across his face. You see some blood splatter, so it's going to be probably a soft tissue injury. If somebody comes in with a laceration in the face, it bleeds a lot, so direct pressure to that area. But once you put the tissue back together, like by suturing it mostly, it will heal really well and have maybe just a line of a scar. The face has so many blood vessels that it's able to heal pretty darn well.
Run!
The likelihood that it went through the eye is pretty low. If the eye got injured with that, typically the bone would have got injured too, that zygomatic arch that sits on the side, or the bones of the maxilla, just because the eyeball doesn't significantly stick out far unless you have Graves' disease. So it's probably related to the soft tissue. You hear the gurgling sound, so the airway has been compromised with blood in there. I've had patients that have upper GI bleeds, they're vomiting blood, and then it dries in the mouth and it just causes such discomfort. You want water, but you can't get somebody water. You increase the risk of them aspirating it or causing more bleeding because you're now, activating the stomach again. Really cool. Awesome game. If you guys want me to react to this game more, let me know in the comments, or are there any other fighting games you guys want me to check out? Definitely leave a comment for me. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything for me. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.